The issue of, before we open it up for general questions, I wanted to get to the healthcare issue, and that is, in your book, the key, in some ways, to getting back to the New Deal and being progressive. And you yourself say that you have written about the simulated single payer being a Rube Goldberg type of system, and you've also written in the book about how the problem with insurance companies is that they have an incentive not to give you health care, so you're actually paying them not to give you health care, and yet you end up, although you're supportive of single payer, with an insurance-based system, and with a private insurance-based system, as I understand your discussion in the book, the silver lining, the redeeming feature of John Edwards' plan, now picked up by Obama, is that the universal health care will also give people the choice of having a Medicare type of system, and so you actually can opt for a government system and competition will win. And so that it seems to me is the silver lining. Without that, you end up with a private health insurance system with certain conditions attached to it.
Okay, now, all right, so the simplest way to give everybody health insurance is just to give everybody health insurance. Medicare for all is where you would want to go in a world where you didn't have to worry about the politics. And you know, if we had, if Harry Truman almost got it in 1947, but failed because the Southerners were afraid it would lead to integrated hospitals. Race always, every time in the U.S. story, race comes into the picture. Okay. I vote for, if I thought we could get that quickly, I'd go for it now. There are two problems with trying to do Medicare for all. And by the way, there's actually a bill, John Conyers has the Medicare for All bill, which he introduces each session of Congress. And it's a perfectly well-designed plan. There are two problems. One is that many people, although a diminishing number, are satisfied with their current coverage. And they're afraid of what might replace it. And they could be scared into thinking that they were being forced to substitute a government program for their current insurance, they'd be worse off. So you don't, you want to offer people the option of keeping what they now have as a political matter. The other is that doing Medicare for everybody requires a large increase in taxes. Now, it's not an actual cost to people because the taxes would simply replace what they're now paying in health insurance premiums, but that might not be obvious and it would certainly be demagogue up the wazoo. So you have, so what's being proposed is something that retains private insurance companies, but puts them under quite intense regulation. So community rating, you can't discriminate based on medical history. Regulation in terms of the costs. Basically saying the insurance companies cannot do a lot of the, you know, I described the private insurance industry is largely in the business of figuring out who really needs health insurance so as not to give it to them. And you regulate to stop that from happening. And you provide subsidies for people who can't afford the insurance to help them buy it, which is a way of stimulating a single payer system, and it's going to be more complicated, and it's actually going to require more bureaucracy than single payer. But it's politically doable, and then, and this is the crucial thing that has been introduced, you also have a public plan that people can buy into. And so you, in effect, allow people to buy into Medicare, which has two good effects. It disciplines the private insurance companies. They can't charge too much because people will just go for the public plan. And in fact, over time, the public plan would very likely dominate. You would actually eventually transition to single payer. And you might say, why all this complicated stuff? And the answer is, oh, I'm sorry, the revenue that's needed, the seed money, if you like, is you don't actually need to pass a tax increase because it's not that much money. All you need to do is allow some of the Bush tax cuts to expire as scheduled. You know, it's this wonderful thing to hide the costs. Bush wrote the original tax cuts so that the whole thing turns into a pumpkin on the last day of 2010. You know, the estate tax is eliminated in 2010, and then springs back to the 2000 rates on the first day of 2011. I suggested at the time that it be called the Throw Mama from the Train Act of 2001. So you get all of this, and it's complicated. It's more hassle, but you can do it. It looks to me as though these plans, and it's essentially now, I'm just calling it the demo plan, because it starts with John Edwards, but the Obama plan is slightly weaker in some technical details. The Clinton plan is almost identical to the Edwards plan. You can imagine the legislation needed for it being passed in 2009. And the whole thing taking effect probably in 2011 after the Bush tax cuts expire. So give me a imperfect but improvable universal healthcare system that could actually be in place by 2011 versus holding out for the absolute right thing that might be in legislation, God knows when. I'll go for this. It's just so much. Once you get universal healthcare, it almost immediately becomes something that people regard as a right. It's something that decent countries do for their citizens, and then we can start improving it. And the fact that I'm thrilled at the idea that we're even in shooting distance of this. I think if we do get a Democratic Congress or president, we have better than even odds that it will actually happen. But obviously, health industry is giving a lot of money. They're going to fight it tooth and nail, but I think we can actually get there.